I'm Sarah Lane. I am here tonight to give a presentation and a discussion, mostly an active discussion, on something that is kind of heavy, and I've kind of resisted putting out the title as so heavy in the past by um, hosting talks and putting things out there that were like, detox your home or, help your child with this and all of that, when really, like, the whole root of my purpose is to help prevent some really serious things that a lot of children and a lot of families are dealing with. And one of the things that is most out there in the media is autism. We hear about autism every night on the news, it seems like. What are the rates now? What is causing this? This increased the rate. This increases the rates. These are new treatments. These things are bogus. There's no connections with vaccines. There is connections with vaccines. Like, it seems like everywhere you look, somebody is talking, autism or something related to it. Um, so everybody's concerned about it in one way or another, or in my opinion, should be in one way or another. Warm? We can. Oh. um, sit over side. So it's a pretty serious conversation, for being worried about your child, being worried about your family, being worried about your nieces and nephews and cousins and, whatever, all of these different types of things. But what can we do about it? Is there something we can do, or are we just sitting around and waiting? Is this going to happen to me? Is this going to happen to my family? I see my neighbor's child, and this child is struggling, and this family is struggling, and it's tearing everything apart. Like, or they've, had to put so many resources, both financial and, time-wise, into a child who is struggling. Um, so in the last, from the early 80s, when the incidence of autism started to increase, more, a lot has been learned. In those early years, it was like, we have these kids with these odd behaviors. How can we treat these behaviors, right? So we have, kids who are flapping, or kids who are screaming, or kids who can't, do these things. Like, how do we treat these behaviors? And a lot of things kind of were created to, like, diminish behaviors, as opposed to really understanding, like, why is this person struggling? So now, almost 30 years later, like, we're really, a lot of us who are in the field of really being proactive with wanting to find answers are learning that these symptoms that have been grouped together as these diagnoses are really just a group of symptoms. And what is the root cause? And by calling them certain things, like calling, like looking at a child who has all kinds of, repetitive behaviors or perseverative behaviors where they, can't get themselves out of, like, one single rut, or they, are bothered by certain things, or can't be in large crowds, or be around loud noises, or can't tolerate, certain sensory touches on their skin. Um, we're labeling these things as autism, when really this child is sick. This child's brain is sick. Like, they cannot gather information and integrate information properly. And why is more important than saying, how can we diminish these behaviors? How can we, change this behavior through behavior modification or punishment type regimes, where it's like, do it this way, and you'll get this. Do it this way again, and you'll get more of this. Instead of, like, how can we create this as a person who wants to do things, wants to learn, wants to be there, and can be there, and feels safe enough and trusting enough in who's around them to be who they want to be. Um, so I think that's enough of an introduction for why I talk about prevention. But I have here in front of me some resources that I've come across, and the resources and the ways that I kind of gather information are not specific to any one field of study or any one person or anything like that. I kind of gather information from a variety of different sources. Um, sorry, double check. Um, and really, what it comes down to when we're talking about autism and some of these dysfunctions is that we need to clean up our lifestyle, clean up our world, have toxins not in our bodies, not in around us on a regular basis. We need to be eating clean foods, and we need to pay attention to if a person is exhibiting symptoms related to the fact that maybe they are not processing something in their environment properly, whether it's a toxin or whether it's a food. I mean, we are designed as, I describe the body as like a crazy chemical experiment. Like, it's like crazy how many chemicals are in our body, how many molecules are floating around, and how many crazy things are happening to help us do everything. Like, everything is chemistry in our body. Everything we eat contributes to that chemistry. Everything we breathe, everything around us, every medication, everything we take contributes to that chemistry. And it's overwhelming to some degree, because it's like, how can I trust that all my chemistry is happening properly? Like, I think I'm a normally functioning person, but maybe there's something going on in there that chemically isn't right. And but I also have discussions with parents, when we're talking about, concerns with behaviors, and parents coming in with concerns of, I think my 4-year-old has ADHD, or I think my 2-year-old has ADHD. Like, why is this child struggling? Why do you think this child is struggling? And to go through the behaviors. Well, my child can't sit still, or my child is, throws temper tantrums all of the time. It's like, this child doesn't want to frustrate you all of the time. This child doesn't want to have you be at your wit's end for how to deal with them. This child wants things to be easy for themselves too. But a young child who's exhibiting those behaviors, I believe, honestly, cannot do anything different. Their brain is not allowing them to do anything different. So I had a school psychologist bring her child in for an evaluation this week. And she's not a school psychologist, she's a neuropsychologist. So she works with a lot of children. And then she was in tears in the exam room as I'm telling her about her child, who she's been trying to deal with from a behavior perspective that he can't see. Like, you're asking him to look, and you're asking him to do all of these things, and he physically cannot sustain clear vision. And he's 5 years old, and they're trying to teach him all of these things, and she's getting frustrated and trying to use her techniques of behavior type therapies, and it's just not working. So I mean, just like, how could I have never put those two and two together? So anyway, children don't want to exhibit these behaviors. I've had children with nonverbal children with autism, can't exhibit eye contact when I look at them and say, like, I can't wait for the day that you can tell me what it's like to be in your world, or like, look at me and be like, you're talking to me. You're talking to me, and therefore I can look at you. As opposed to, a child with this same child who doesn't feel safe or doesn't feel like anybody understands or even cares what he's doing is, running around the room and flapping all the time, because nobody's actually looking at him and saying, like, this is hard for you. Like, I can't imagine how difficult it is for you, but I can't wait for the day that you can tell me what it's like for you. It's just to acknowledge that piece is interesting, and takes a lot of work to get to that point, to be dealing with these types of behaviors. And I myself don't have a child who struggles at home with these types of behaviors, so I can't even imagine what it's like being in 100% of the time with a child who has these types of things. To keep that philosophy and mindset rolling all of the time throughout your daily life is the most difficult job as being a parent. To normally functioning children, and to have to deal with these things is hard. But anyway, so let's start talking about prevention. So what I'm going to use as my kind of outline for prevention today, and guide for kind of how I piece things together, is a new book that just came out, written by my friend Patricia Lemmer, called Outsmarting Autism. So Outsmarting Autism is basically a compilation of all different kinds of things that Patty has done since the early 90s. She was the co-founder of an organization called Developmental Delay Resources that focused on helping parents find resources for their children who are struggling. And it's kind of, over the last few years, kind of taken a little bit of a turn for, like, how can we help prevent many of these children from struggling in the first place? So in here, which is something we kind of go through steps. But first I want to give you kind of, I've given it already a little bit, but autism to me is kind of like the highest level of neurological dysfunction that we can see in a person, a child who's struggling. So when we talk about these behaviors, we've got, kids who are dealing with sensory processing disorders, and we've got kids who have attention deficit disorders, or we've got all these things that are now like kind of not even diagnoses anymore because of the new classifications of things, but used to be called like pervasive developmental disorders and things like that. They're all, the body is not functioning properly. The brain is not functioning properly, not allowing behaviors to happen normally. So autism is just kind of the worst case scenario in that whole scheme of things, where we have a brain that cannot process and cannot integrate information and is just completely disorganized. So a lot of the behaviors that happen, I kind of view it as that we have nerves floating through, or nerves conducting information in our body, and those nerves are conducting electricity. And if those electrical circuits are allowed to continue in a continuous pattern with no fires and no sparks and things like that, we have a normally functioning person who can gather information and integrate all that information. When we have sparks, when we have fires, when we have things that are like frazzling us, which everybody experiences, like if you, something like shook you up that day, or somebody said something and you get yourself like upset about it, like you can feel like your shoulders tense up, you can feel your fist clench, you might even be able to feel like, oh, this hurts in this part of my body, or create like muscle tightness and soreness and these things by reacting to something. So when somebody is dysfunctional enough to warrant a diagnosis of autism, there's fires everywhere all over their body. So these neurological circuits are not complete. All the time, these sparks and these fires all over the place that are needing attention. So the way that somebody brings attention to those fires is by doing behaviors that they know and that they feel safe with, which is what I feel a STEM behavior becomes. Like, I need to create like something that my body and my brain can make sense of. So if my body and my brain can make sense of my flapping my hands, or my moving my body, or moving my head in a certain direction, then that helps me put out that fire, that loud noise, or that baby crying in the other room, or that tag in the back of my shirt is creating for me, or like that food that I ate earlier today that my belly is just feeling horrible. Like, there's just something I can do as somebody who doesn't know how to get rid of that fire. So that's kind of how I view that. So in talking about prevention, there's a theory of autism. It's called the total load theory. And then what we're talking about when we're talking about the total load theory is that when does a person reach that threshold for their brain and body just not being able to function anymore? Why do some people have reactions to vaccinations, and why do others not have reactions to vaccinations? Why are some people sensitive to things in the environment and the food that they eat, and some people not? Like, why do some people get sick for a day and some people get sick for 3 months? Like we're all different. But this total load theory is that the body holds toxins and holds things to a certain point. And it's after that certain point that things just go all awry. Babies can hold toxins given them to them from their mother, where the mother has had toxins in her body given to her by her mother, and so on and so forth, back generation and generation and generation. So we've got this, accumulation of potential toxins and potential dysfunction in a baby who's born if mother and previous generations haven't cared for some of these things. And then we just kind of top it off with a preservative, with a food coloring, with a vaccination, with a something that's in our environment now to get, to kind of put somebody over the edge. And our world right now is extremely toxic. I walk into the grocery store, it's like, who's buying all this food? Like, because all my cart is like fairly empty when I go to the regular grocery store with just a few items, that like I know I'm going to that store specifically for. Like I most of the food available like has all kinds of preservatives. It's been basically unrecognizable as food, and it's just that's just the beginning of the toxins. We've got pesticides being used on everybody's lawn. Like I was just telling my husband, like, why do we have ants all over our driveway? Like we're the only people in the neighborhood probably that don't treat our entire property with pesticides. So they're all coming to our driveway. And I get it, a little bit of a pain. I don't want them there either, but like I'm not going to spray my whole property with pesticides just to get rid of them. But does that make sense about the total load theory? Okay. So kind of the first step for prevention is, and Patty has this in here as her steps, is to take away the bad stuff. And so how do we take away the bad stuff? Is we make conscious decisions about what we're bringing into our house, what we're putting in our bodies, what we're putting in our children's bodies. And I mean, that's a very, very broad topic, because you can go everywhere in your house, open every cabinet, every drawer, every door, and most likely, like if you haven't already been through the long process of detoxifying and making those decisions more consciously, like there's chemicals and toxins throughout your entire house that could potentially be harming your family. Like I have a mom that I recently talked to who was telling me that her 18-month-old daughter has asthma and uses an inhaler. And I asked her, I was like, so what do you use to clean your house? This was somebody that I didn't know exactly what I did or what I do. And I was like, so what do you use to clean your house? And she was like, I just love the smell of Bleach and Fantastic. And she was like, I clean the entire house with Bleach and Fantastic, all the time. She's like, I just love it. It just makes me, I was like, I looked at her straight in the face and I was like, you are creating your daughter's asthma. It's like, you are creating respiratory distress for your daughter. I don't know if she'll ever talk to me again, but I mean, I believe that, and I can't not tell her that as somebody who I'm having a conversation with, and I guess that's why I have a few friends, but I can't not tell her that because that's there. Those are significant toxins in the air of her home and on every surface that her child comes in contact with. And her daughter now has a medical diagnosis, and the medical treatment is a steroid inhaler. Like, is that like sustainable? So I don't think so. But so cleaners in the home is like one place to start. Like, using natural cleaners, using, things that you make yourself with vinegar and water and lemon juice and all of these types of things can clean really well without creating that, toxic cloud in your home. Laundry detergents, dryer sheets, all of those different types of things. Like, being okay with a little bit of static, it's something that, it's, or the alternatives, I think, what are they?
I have wool balls that I got off Etsy, and they actually, they decrease your dry time, they also take the lint off, they help with the static, and it's less wrinkly when it comes out.
Right, yeah,
and
so there's lots of options. Yeah. But it takes, like, looking outside of the mainstream grocery store for the things that you're going to use in your house. Shampoos, soaps, like a lot of the shampoos and soaps that are marketed even for babies are loaded with chemicals and toxins that you really don't want anywhere near your children. And it, it can seem that it's a little overwhelming to be like, well, I walk into the store and I need soap. Like, look at the label. If it's got tons of things and all kinds of chemicals, most likely, like, no, this isn't it. You want to find even a soap that only has like a few ingredients, and you can say them. You can recognize them. It doesn't have to be like all these, chemicals in those soaps. And now, as opposed to, I would say 5 or 6 years ago, like even at the mainstream grocery stores and things, there are products available that are more responsibly made. People are paying attention to these types of things a lot more now than they were like 5 years, just 5 years ago. Toothpaste. Toothpaste is another big area when we're talking about for ourselves and for our children. Like, the United States has a big campaign for a number of years, and I at times know all of the statistics and dates and things like that, but right now I don't have them on the tip of my tongue, but for getting fluoride into the water. I mean, and it's even gotten so far that they've got Poland Spring waters, mini-sized Poland Spring waters, marketed towards like bring this to your kid's school party, and these things with fluoride in them, like
And
nursery water with fluoride in it, and like pediatricians are telling people. I mean, they told me at 6 months old that nursing was of no nutritional value, and that I needed to be giving my baby, water that had fluoride in it and a multivitamin because that was what he needed to be healthy. Fluoride is an absolute known neurotoxin and should never be ingested into the body. It's meant, and in toothpaste, there are some people who say that it's safe because it's applied topically, and theoretically it will not become ingested, right? But when you're talking about dentists and pediatricians prescribing oral fluoride pills to children all the time, like it's just normal practice, and it's an absolute known neurotoxin. So I tell my dentist, like, I don't even want you to give me the sample of toothpaste because it just creates drama in my house when I have to tell my kids, like, no, we're not using the blue sparkly toothpaste. I threw it away. Like, I don't even want it in my house. But then the whole aspect of like, why would a dentist and why would a pediatrician recommend fluoride? Well, they're recommending it because they believe that they can prevent cavities and promote tooth growth with fluoride, which...
Well, and if I'm up to date on my understanding of it, topical application directly to the tooth has been shown to remineralize enamel. But there has never been, to my knowledge, any information or research that taking it internally has any effect whatsoever on your dental health.
Yeah, absolutely. And it definitely doesn't encourage tooth growth.
What the detriment either.
Right.
What was that?
What the detriment would be either.
Right.
Like, is it worth it?
I mean, I know a friend of mine whose daughter has Down syndrome, developed seizures. And he was like, where did this come from? She's like 14 years old, like never had a seizure before in her life. And they figured out that she had been eating the toothpaste. And she had a fluoride toxicity that was creating seizures. So it's not safe to be, consumed into our bodies. So that is a big one. Mouthwash marketed towards kids that has fluoride in it. Yeah. It's not good to be there. As far as to cleaning out and getting out the bad stuff to prevent autism before our babies are even born, like I tend to do a lot of talking about a child who's already here, because that's what I see professionally at my office, and I'm talking to parents who are already working with a child. But cleaning up your life before you have a baby inside of your body is extremely important. Making sure that you're not passing over all of those toxins, that your body is clean, and that involves like the cleaners and the soaps and the detergents and the foods that you eat, making sure that your gut is functioning properly and detoxifying properly.
Is there a book or a program that you recommend for that?
There's a lot. Every person, I believe, most likely has a different need for how they will, go through that process. I mean, I don't have a specific book or protocol for like just going through your house and cleaning out all the toxins. You just have to, do that on your own. And as far as like, finding a doctor or finding a professional to help guide somebody through a detox program, I have found pretty challenging in this area particularly. Because doctors haven't gotten to, most of the people that I've interacted with haven't gotten to the point of putting themselves out there to take that accountability. For like, medicine doesn't believe in any of these things to clean up your body, I have a pediatrician near my office who says he doesn't believe in probiotics. And like, I look at him and I'm like, probiotics are not a religion. It's like, this is, so you cannot say you believe or you don't believe in the use of probiotics. You've given this child 6 rounds of antibiotics this season. Right. You've destroyed the bacteria in their gut. Like, for you to say that you don't believe in a probiotic is like, you're just not thoroughly thinking through what you've done.
And there is a lot of evidence-based information.
There absolutely is. There absolutely is. But that's kind of, it's been difficult for me to, guide people towards like, finding a doctor, finding a program. There is a book called The Brighton Baby that's like so overwhelming. It's like an encyclopedia. It's about this thick and it's dense. With the print actually in it is quite big, so it's easy to read once you get into it. But it's a lot, and that's basically, I consider it like a reference guide, an encyclopedia, because most people will not need the entire book. But it is a step-by-step protocol for having a healthy baby, detoxing absolutely every single aspect of your life, involving diets, involving certain cleanses of different organs in the body, involving a lot of Chinese medicine and herbs, which, you would seek a qualified provider to help you with those types of things. But he's got a ton of information in there. And that's a book written by Roy Dittman, which is, in preparing some of these presentations in the past, I came across his book when I hadn't been aware of it. It just came out last year. It's like he's writing the textbook as I'm preparing a presentation. It was kind of neat. See that I and my other couple close friends aren't the only people, because he's all the way out in California, talking about some of these things more widely. What else? Anything else? Anybody have any questions about what we need to get out of our lives? I was recently up, there's, summertime with the ice cream trucks and all of that stuff. Like, it's like, well, what choice do I make? Like, am I going to keep my kids from enjoying these, memorable events, or am I going to, like, participate in some way? So I basically give my boys, like, two options. I give them, like, the ice cream sandwich or the fudgicle, because they're fudge colored. Like, maybe there's a little bit of caramel color in there or whatever, but there's no red number 40, there's no orange, blue, green, like, all of that kind of stuff in there. And then one of my older children ordered, like, the red cherry ice. And I can't say as much for her. And, she was like, why can't the boys order these things? I was like, well, there's all kinds of toxins and poisons in that. And she was like, well, now you make me feel bad. I don't even want to eat it. And I was like, well, that's kind of my point, because I want to get you to the point where you can make that decision for yourself. But it's kind of hard to tell a 14-year-old what to order off of the truck the same way you can a 3 and 5-year-old. So, but that's another big one, is, all of the additives and food dyes and chemicals in food, just eliminate them. My husband has a general guideline. It's like, if it's in a box or a bag, like, it doesn't need to be part of your everyday diet. And then using that as a general rule, you'll end up eating lots of fruits and vegetables, lots of whole grains, things that you're preparing and cooking yourself. Lots of soups, stuff. Not this time of year, it's a little too warm for that, but, all fall, winter, and spring are great seasons for, preparing those things a lot more healthfully, so you can have food ready.
And I think that's one of the biggest challenges, is living in a fast world where trying to stay clean. Even like buying cleaners. Like, we're seduced into buying things all the time. Oh, it's natural, it's this, and then you look at them, and it's really hard sometimes to discern whether they really are or not.
Right. Yeah,
it's
so the brands that we have come to kind of gravitate towards are 7th Generation, makes some really great products. Nature's Gate. Their products I find are really good and reasonably priced compared to some other ones.
I like BioClean a lot. BioClean and Ecover. But again, you flip that over and there's circumference. I can't even pronounce half of the thing. Thank you. Like I said, I can't pronounce them. But it'll say, oh, it's coconut derived, or it's this or that, and it's so hard to know what's more of an acceptable thing. Because honestly, when it comes down to it, I don't like the smell of vinegar, so I'm not going to spray it around. So I'm frustrated because I want to use. I don't need bleach. I don't need all these. I can tell. Honestly, when you spray it, you can tell immediately if something's making you go. Yeah. Like Windex practically puts me in the hospital.
I remember in college, moving into apartments and absolutely disinfecting to the point where I was dizzy.
Right.
Who's been in this bathroom before me? It's disgusting. And I didn't know any better. I was like, I'm gonna get the scrubbing bubbles and the Clorox because this needs to be clean so I can use it. And I don't know what I would use now. So I don't know what I'm gonna do for my kids when they're in college and I need to clean a bathroom.
Well,
steamers work really well.
Okay, that's a good tip.
Then you're talking about nothing toxic, and the heat is enough to kill it. And honestly, like, my oldest definitely went on a little, like, kick with it because she thought it was so fun to, like, steam blast. And so she was steaming out my refrigerator, and I was like, this is awesome.
Oh, cool. That's a good tip. I don't have a steamer.
Yeah.
But yeah, EWG, the Environmental Working Group, on their website now has, they started off with a section of their website that's called Skin Deep, that they will kind of grade all kinds of products that are out there and tell you, give them either a green light, a yellow light, or a red light, telling you like what the safety and toxicity level is of those. EWG now, has a cleaning guide, for all cleaning products and things like that, and they also do like a sunscreen guide every year. What else do they do? Is there another one?
They do makeup. I think they do makeup.
That's on the Skin Deep.
Yeah.
That's the makeup and all the self-care products.
Because it does help.
And soaps are there.
It really does help. I mean, I want to make everything myself, but I just can't. I just not at this point in my life. It's just I don't have the time or the energy or the brain power.
Yeah, I don't either. I mean, I make a couple things myself. I'm still on making my own deodorant. It's been, a couple years, and it's still working, which is like longer than any product I ever bought worked. Had to change, every couple months. But that's the only thing I make for myself right now. And then some cleaners every once in a while if my 7th generation bottle is empty. Some vinegar and water and things in there. Yeah, EWG is a great resource. All right. So, in talking now, so that's the basic idea of preventing prenatally before you have babies is cleaning up your life. Getting toxins out of your body, out of your life, recognizing if your body is dysfunctional, if your gut's not functioning properly, caring for that. Like those are huge pieces in the prevention puzzle. The second, if we're dealing with a person who shows some signs of struggle, is to recognize those signs of struggle as absolutely early as possible. And those signs of struggle in an infant could be as, simple as like, colic or acid reflux. You have a colicky baby. Colicky baby is a baby who's struggling. Like, they're crying all the time because there's something bothering them. And like, we don't know what it is. A lot of times, like parents, and I have not had a colicky baby, so I don't know what it's like again to be in that situation. But and sometimes it feels like you just can't never figure it out. And then one day, they just grow out of it. But like really, one day their body develops something different where they're not as uncomfortable. Why were they uncomfortable? I don't know.
I see a lot of food sensitivities
with
colic, a ton. Like I would say, of the babies I've seen over the last decade, 95% are food sensitivities, and the remaining 5 are birth trauma or something like more significant.
Recognizing that these aren't colicky babies, this isn't the baby's problem. Right. This is the baby is reacting to circumstances. The baby is reacting to the foods that the mother is eating, the environment that's around them, or the situation that they were involved in surrounding a traumatic birth. Like, trauma happens to babies, and they experience it, and they internalize it, and how can they react to it? Like, trauma happens to somebody who has developed consciousness and the ability to articulate what's going on in their world, can tell you. Sometimes not, but the behaviors can show you that this person is struggling. If you've got somebody who you previously were able to have a conversation with and now you can't have a conversation with, or somebody is showing like that they're withdrawn or exhibiting dangerous behaviors or things like that. Like for an older child or an adult, you can recognize those things. When you have a baby who's experienced trauma, like what's your baseline? Like it's really difficult, and people are brushing those things off. And just saying, like, oh, that was the worst day of my life. My birthday, the day my baby was born was the worst day of my life. I never want to relive it. I don't want to think about it. I don't want to do anything. But now I have a baby, and my baby is all of these early signs of what I consider their neurological difficulties. You know, they can't comfort themselves. They're crying all the time. They can't process their food. They have acid reflux. We have to pay attention to solving those problems. And the way some of the early treatments would be like finding a chiropractor to help out with some of those things, recognizing food sensitivities, definitely, and, you know, empowering people to, like, you know, it's not just a fad. It's not just a fad to not eat gluten or not eat dairy or those types of things. Like, if your child or you are having legitimate symptoms, like, you have to continue to turn over every stone until your symptoms go away. And I've talked to doctors about my own personal things, and I kind of I feel like sometimes that I'm too particular, or like I have my expectations are too high for how I should feel. You know, like, I want to feel good. Like, I want to know, like, why am I not feeling good? Like, what can I change? And I've changed a lot about my life, but there's things that I still feel like I react to, and I haven't figured it out yet entirely. But it's like we should have high expectations for the way that we feel and the way that our body functions. One of the biggest kind of flags that I see in a lot of kids is chronic runny nose or chronic stuffiness, where, you know, this child, they're clearly talking through their mouth, you know, not breathing through their nose at all, having that kind of a nasal sound to them. And parents are like, oh yeah, I never really noticed. You know, like, does your child have, you know, ear infections? Oh yeah, we had like 6 ear infections this past year. You know, do you take antibiotics? Like, no, the doctor said it's just inflammation and there's fluid in the ears all the time, and sometimes we take antibiotics and sometimes we don't. And it's like, okay, so what are we doing to handle this chronic inflammation in this person? And they're like, oh, what should I do? You know, pediatricians aren't like coming forward and telling people how to deal with that chronic inflammation. I had one patient recently, within the last couple of weeks, who I just said, I was like, he needs to stop eating dairy today. Like, no questions asked. Like, what are you messing around with? You're telling me that he's struggling and he's congested every single day. Like, try it. And within a week, like, he was not congested at all. And she actually came in today and said that, you know, I bought the cheese that, you know, he likes, and he ate a piece of the cheese, and now he's congested again. And it's going to last until his body processes or gets that stuff out. And this kid is 4 years old. He can't, like, consciously make all of those decisions for himself, you know. And I tell, you know, a lot of people, my husband has the philosophy that, like, kids won't starve themselves, which is hard because you want them to eat, you know, and it's like you want to provide them with food. But if you have a child who you need to create changes for, like, it's not going to be easy. Those initial couple days of saying, like, you know, no, you're not going to have, you know, your 4 glasses of milk anymore, period. Today, we're done. You know, I have kids who come in who say, you know, they're all kinds of symptoms of, you know, attention issues and behavior issues. And I ask the parents, like, what does your child eat? And they're like, oh, you know, he doesn't eat very much food, you know, but he drinks 4 glasses of milk a day, and they're happy because he drinks his 4 glasses of milk a day, which means he's getting his calcium, he's getting his protein, but his behavior is through the roof, you know, and he's sick all the time and all of these things. And it's, you know, a lot of children who are having a difficult time processing dairy actually process the sugars in the dairy to create like an opiate type chemical in their body. So they're living their life like in this state of being high. So they're addicted to it, and they need it, and they want it, but it suppresses their appetite for all kinds of other things, and it makes them sick, and it gives them runny diarrhea, but they still want it because it's creating this kind of euphoric type feeling for them. So it's, again, I personally have not had a child in my house who I've dealt with this with, but I try to convey to parents that I'm talking to, like, this is not going to be an easy process. But your child has, you know, red flags all over the place that tell you that he's sick. Are you going to continue to let him be sick? Or are you going to get to the root of the problem? And it's a difficult conversation because children are really at the mercy of the decisions that we as parents make. And I've said a couple times that, like, I don't have at home a child that is struggling, but, you know, I started learning all of these things probably 5 years before I ever got married. And at the time felt that I was like, why am I learning all about autism? Why am I learning about all of these chemicals and toxins in the environment and how they, send our bodies all awry and all of these things? Like, am I like subconsciously like preparing myself for like having a child who's going to struggle? Like, I was like, why? Like sometimes it's like you don't know why, and then something happens. But honestly, like every decision that I make, and started prenatally, all the way through to my birth, what I chose, providers that I chose, and how we did that. Every decision for food and all of those things has been in the context for like prevention, just because of what I have known. So I don't know why my kids are the way they are, but I can't help but believe that like a significant piece of that is because of I knew these things before I even thought of having them. And my husband is on board 100% with all of it, which is really helpful. Like, I don't have to convince him, that I'm not going to buy him, like, Irish Spring soap. I know a lot of men talk about, like, I need to smell a certain way, I need this certain soap, and I don't have to convince my husband of those different types of things. Or that, my husband is not eating, pork roll. I don't need to get that out of his diet, or soda, or anything like that. But so in dealing with young children, it's often early intervention services are some of the first people who are called upon when somebody has a child who's struggling, but people don't call upon early intervention services when their baby has colic or when their baby has acid reflux disease or those types of things. Early intervention services are called upon when a child hasn't met a developmental milestone, like most commonly these days is speech. Like you have a 18-month-old or 2-year-old who's not developing speech properly, and the early intervention about is called upon. Or you have a 18-month-old who's not walking, because that's basically pediatricians won't write a recommendation for early intervention until a child's 18 months and not walking. Which is kind of frustrating because there's a lot that can be done before that to help encourage that to happen normally. But those services are limited with what they can provide and how thoroughly they can address a situation. Like, I haven't interacted with a family who worked with only one type of therapy when they recognize that their child is struggling. Like, we've addressed our diet, we were seeing a chiropractor, we might be doing craniosacral therapy, we, might be working, occupational therapy, physical therapy, all of these different types of things, speech therapy, vision therapy. But it all depends on how early you catch it, too. How much therapy you need. Like, if you recognize that your infant or your toddler is struggling with, foods that they're eating, or their gut isn't functioning properly, they have eczema all over their body, and you can remedy that by early interventions of your own, then you can potentially preserve and enhance how their brain develops to the point where they won't develop the more severe neurological symptoms that are being labeled as all of these other conditions and disorders. There's an organization that's called Epidemic Answers, which is a fantastic resource, and a whole panel of people who are basically committed to helping people recognize and treat what we consider like soft signs. Like, we want to prevent a diagnosis. We don't want to get to the point of looking at somebody and asking me, like, does my child have autism? Like, is my child's behavior worthy of a diagnosis of autism? We don't want to get there. We want to recognize early enough that these people are struggling and solve the problem. So they have, you can call and email and get in touch with the people. Somebody from their board will get back in touch with you and try to guide you through, like, this is what, resources you need to look into for yourself. And it is a lot of, like, self-guided things. Like, you have to be on top of it and willing to self-initiate a lot of those things. Epidemic Answers is working on a film right now called Canary Kids. And what they're doing is they're raising money to provide treatment from beginning to end for like 12 children. And their treatment is going to involve all kinds of alternative therapies. I don't even know all of the alternatives that are out there because there's a lot of them. But things that, your medical doctor would never even imagine, or isn't even aware exist out there. And they're going to profile through this film these families and their road to recovery or treatment of these different things. And then the title of that, is The Canary Kids, is that there's a whole movement of recognizing that our children are like our canaries in the coal mine. That they are crying out that something is wrong with the way that our world is moving forward, with all of the chemicals and all of the toxins and all of the ways that we're doing things, that they're struggling. You know, to go from it being more normal now to have, like, I mean, what do they say? Like 1 in 6 children are struggling with some kind of developmental concern or learning issue. I mean, that's a significant number. Very significant number. And like, are some of them, is it just as simple as them eating properly? Probably a lot of them. You know, I mean, if you see a kid walking to school with a Pop-Tart every day, or knowing that they had like Cocoa Puffs every day for breakfast, you know, and I mean, not to say that you can't enjoy a Pop-Tart or a Cocoa Puff or whatever every once in a while, but if that's like all you eat every day, like, it's going to affect the way that your brain develops and the way that, you know, you're capable of doing things. So those, we've talked about a lot of things. Mm-hmm. Anybody want me to talk about anything else specific? Or looking for anything more for kind of fuel? For
I'm good.
I would just say that that process is a transformation, like to we'll say detox your life. It's not just what you eat, but the chemicals and all that stuff, and it's not overnight.
No, absolutely not. And it can continue for years and years and years. Like, I definitely, I don't know if we'll ever be done, because every time you go to the store, it's like a new kind of decision-making process. Every time you look up a recipe to make something, it's like, you know, am I going to use that, or am I going to find an alternative? You know, like, you see all these fun magazines that are like, you know, quick family recipes, you know, prepare this meal in 10 minutes. And it's like, as a working mother, it's like, hey, that looks great. But when I look through the recipe of the things that they're asking me to use, and it's like, okay, like, that's just a bowl full of toxic food, because all I'm doing is taking things and pouring them from other cans and bags and putting them together. And I mean, that's just not, to me, a real option. But it looks good when it's, you know, in the magazine. And it sounds good, because it should only take me 10 minutes, but that's not reality. But yeah, and it's, you know, like, you know, you were saying before, like, it's not easy to have a child, period. Like, it's not easy to make changes in your life at any point in time. And, you know, when you're having a child, it's like, I feel like it's like the ultimate responsibility, or the ultimate, you know, reason to want to, like, analyze these types of things and look at them and be like, how can I create myself as the most well-functioning person, and then also want my child to be the most well-functioning person, and recognizing when somebody is struggling and looking for that help. Like, I mean, examples, I know that it's what I do for a living, so it's easier for me to, like, look at the way my children are functioning. And, like, there was one time where, you know, for about a 2-week period, like, my son wouldn't let me change his diaper. Like, absolute fits, like, screaming. And he was like 18 months old, like, towards the, you know, he was already using the potty sometimes and those types of things, but, like, still in diapers. And he wouldn't, he'd just scream at the top of his lungs every single time he did it. So recognizing that, like, I can't punish him for this behavior, because there's something he's scared of. There's something about this situation that isn't working for him. And, like, I have to recognize as a parent that, like, I have to create the situation a little bit differently. So I used, you know, some of my techniques of, like, balancing out, like, his how he processes sensory type information. And some of those techniques involve, like, you know, like I talked about with the circuits of electricity through the body. Like, so when he's having this fit, like, I go into this picture in my mind, like, so where's this electricity going awry in his body? Like, where are these fires? Like, how can I put them out? And some of those things involve, like, just, like, deep pressure on the side of his hips. And, you know, deep pressure in his legs and in his feet and these types of things. And doing that, like, while he was in his bath for a couple nights. And then as we were reading stories at bedtime, like, just kind of, like, you know, giving his body that bit of information, and then it was gone. You know, like, I don't even know how long it lasted, but just being able to pay attention to something's not easy. Like, how can we make it easier without punishing? Because an 18-month-old kid is not doing it to make me angry. So a lot of information. I mean, all of the resources that I have up here are interesting, and some of them in a different way. Like this book, it's called ADD Does Not Exist, which is a little in our current world where like it seems like everybody is worried about ADHD too. Like even kids who are nobody's worried about autism, but like my kid can't pay attention, my kid can't sit in the classroom, maybe they have ADD. Or my 3-year-old is very active and runs around all the time and wants to do everything, maybe they have ADD. ADD is like basically a garbage diagnosis in my world. Like it's like, why is this person struggling? Again, into everything that I just said, like why is this person struggling? Like if you have a 3-year-old that you're trying to require to sit down at a desk and do pencil paper activities, like that's the problem. Like this child doesn't have ADD. This child wants to use their brain. Like you have to change the situation to allow them to use their brain. Or if a child, in the afternoon after lunch every day can't sit still and is exhibiting all these crazy behaviors, and they're eating like a bagel every day, or pizza every day for lunch, or pasta with butter for lunch, and it's like, okay, so what's happening in their day that's contributing to their difficulty in the afternoon? They're eating food that is creating all kinds of difficulties in their body. That's the problem. They don't have ADD. And it's not like, we kind of say, those of us who work with children who have autism and some of these diagnoses, like if you've seen one child with autism, you've seen just that. One child with autism, or one child, because every circumstance is totally different. Like it's a totally different story for every single person. And I think it's that way in the grand scheme of the world, but like in specifically talking about these children who are not functioning well, we really, I feel like, owe it to them to like figure it out. Without labeling them and creating more problems.
And medicating them and adding more toxins.
Yes. Right. I also have, some of my patients who, when I talk to them about, the medications that they're giving to their child, and then like, is it working? Is this stimulant medication you're giving to your child? They're like, well, he'll sit in the classroom. Like, is he learning? I mean, these kids come in like zombies.
Yeah, I have a friend who's
completely flat affect, not engaged visually. Like they're zombies, and they're intoxicated on these drugs, and like, but the goal is that they sit in the classroom.
Yeah, I have a friend who recently, I can't believe the difference in her child. Cannot believe the difference. Bright, vibrant, bubbly child who's, like you said, a zombie. And again, what's the success? What is the success? I can't even say it. What is the success? Here's a child who's not the same.
Right.
But taking away who they are, just so that they'll sit or focus. It wasn't even about sitting so much for her, as much it was, staying at task and being able to focus.
Right. Yeah.
It's so sad to see.
It is. It's very sad to see. I mean, I have some of the kids I work with, will not be using medicine when I start working with them, and parents decide for a variety of reasons to go that route, at the counsel of their medical doctors and psychologists and things. They are being pushed hard. And, I am very upfront and honest with them about disagreeing with that decision. Because I can, like, these kids, when they come in, they're a lot of work. But like children should be a lot of work to figure out, how to engage them and how to, kind of foster their love of learning and those types of things. Like, it shouldn't be just like, not every kid is going to sit there and just do this rote work, especially the little ones. They shouldn't. People keep asking me, like, why are you sending your son to school? Like, why aren't you sending him to, why aren't you doing this and that? And I'm like, I mean, my dad was giving me a hard time even tonight. She's like, he's going to be 7 in first grade. I'm like, I don't even know where he's going in first grade. That's not even part of my problem. But, like, I'm not ready to have him sit down at a desk and do pencil paper activities all day long. It's a smart, creative kid.
Boys don't ever do well with that.
Yeah, but in other parts of the world, like, they're not asked to do that until they're like 8 or 9 years old.
And
they do fine.
Kind of goes to the lowest denominator. Like, this is how we feel education works best for us overall. You know, so and it's a shame because in our country, it's definitely been the physical aspects of moving their bodies has been like diminished. Recesses are shorter and shorter. Phys ed programs are less important. You know, but definitely.
These do art programs, music programs.
Yeah. Mm-hmm. But I think, you know, the boy is just being generally a little more physical. It's more extreme with them because the girls tend to mature faster and are okay with the sitting quiet. You know, not all girls, but generally.
Well, and that's why there's more boys who are diagnosed with
ADD.
Yeah. In this particular book, Brain on Fire, which is not a book necessarily that has close ties to talking about children who are struggling, but it profiles a woman who was ready to be institutionalized for what they thought was, you know, extreme psychosis, and then they discovered that she had a very rare type of encephalitis, and once that was treated with the appropriate medication to relieve the inflammation in her brain, her symptoms subsided. But her rehabilitative process has been very similar to what would be necessary for a child who is recovering from autism, with all of the sensory aspects, with all of the body detox kind of aspects. Like, she's had to go through all of those types of therapies to get back to being functional. But it's not a psychiatric diagnosis. It was a medical issue that needed to be addressed, and took a lot of people thinking way outside of the box to discover what it was. So it's like the very end of this book, Brain on Fire. She's a journalist. She kind of goes through that thought process for, like, how many other people who have been diagnosed, whether it's autism or schizophrenia or whatever it is, are struggling with this same thing that I had. And they're, by circumstance, like, not in and around the doctors who are looking for this very rare condition.
So I think if there aren't any other questions, the only thing that I think might be good to close with is, if somebody knows or suspects that their child is somewhere in that spectrum of autism, what do you think the most important or the first step should be? Like, is there a specific resource, a specific book that you think is best to start with?
I think visiting the website, the Epidemic Answers website, is a fantastic place to start, because it goes through a list of symptoms, and it tells